Hi, I'm Stephen Jones, Chairman of the New Jersey Hospital Association, which delivers support and services that help our members care for their communities. That's why we're proud to support important healthcare programming produced by the Caucus Educational Corporation and their partners in public television.
Gynecological cancer, next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by TD Bank, the New Jersey Education Association, working for great public schools for every child. Berkeley College, New Jersey Natural Gas, proud to support education in our communities. QualCare Inc., a local managed care company covering 750,000 New Jersey residents. Johnson & Johnson, and by NJM, auto insurance, homeowners insurance, and more, with a focus on safety and financial stability.
Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, gynecological cancer can be extremely difficult to detect, which is why women need to be aware of the warning signs. Joining us here in the studio to discuss this very important health issue, we have Susan Seguin, who is an endometrial cancer survivor, and we also have Dr. Mira Hellman, is a gynecologic oncologist at Robert Wood Johnson University Hospital. Ruth Dugan is president of the board of trustees at Gilda's Club of Northern New Jersey. And finally, Melissa Donahue is a licensed clinical social worker and certified sex therapist. Throughout this program, you're going to see websites that are going to be extremely helpful. Susan, I want to get this right. The kind of cancer you are a survivor of, I want to say it the correct way.
Endometrial.
Endometrial, which means?
The lining of the
uterus.
The uterus.
You know, right out of the box, seriously, we're talking about 5 types of gynecological cancers, doctor, right?
Essentially.
And just having this discussion right here, as I was getting ready for the show, I always think I know something about the shows we're doing. I know nothing about them. I mean, less than nothing. Am I alone in how little I know and how little most people know about gynecological cancers?
No.
Because there are 5 types.
There are basically 5 types of gynecologic cancers. It is an area in medicine that I feel, as you stated, doesn't get the same attention as some of the other fields of medicine do, and therefore patients and people, the general population, they have a less of an understanding of what's involved with it, how to look for it, what you need to see the doctor for, and what screening tests they need to undergo to help detect these kind of things.
We're talking about the reproductive system.
Correct.
Can we go through the 5 cancers we're talking about? We're talking about cervical, ovarian, uterine, vagina, and vulva.
Correct.
One more prevalent than any other?
So in terms of prevalence, uterine cancer is the most common gynecologic malignancy in the United States, as it is in most developed countries around the world. But if you look at third world countries, cervical cancer actually is the most prevalent cancer, and it is associated with many, many deaths a year. This is something that we've managed to control in the United States with something that I feel a lot of women actually are aware of, which is Pap smears, which is a screening test that came out which significantly helped detect cervical cancer before it developed into, pre-cervical cancer.
How often for a Pap smear?
So the recommendations keep on changing. The most recent recommendation, actually, which is something that Susan and I were discussing before, the recommendations for screening is once every 3 years.
Once every 3 years, beginning?
It is now beginning at the age of 21.
21?
Correct. It used to be at the age of 18 or at the onset of sexual activity.
Okay.
But that has recently changed. In addition, now there has recently been a statement that came out in terms of cervical cancer screening, looking at screening for HPV, which is HPV is human papillomavirus, which is the culprit in majority of cervical cancer cases that develop.
I thought there was a vaccine for that.
There is a vaccine for it. The vaccine is a tremendous intervention that has recently been approved, not recently, actually a couple of years ago, been approved by the FDA in terms of preventing cervical cancer. Despite that, there are unfortunately a lot of people who do not get the vaccine. It is not a requirement like some immunizations are for pediatric care. It's not a requirement. It's something that's optional. And there's a lot of debate about this.
All right, let's open up the discussion. By the way, again, this program, part of all of our health and medical programs designed simply to provide valuable information to our audience in public broadcasting and our audience on FiOS as well. You'll see websites throughout this program. Use those websites to get additional information. Susan, your journey, describe it.
Oddly enough, I ended up with a cancer which was not one that I would watch for. I didn't even really understand like you about endometrial. I was very careful and went to my gynecologist, and we watched ovaries, we did the pap smears.
Any history in your family?
Yeah, well, not of gynecological cancer, but of both parents deceased of a asbestos-related cancer. So I was always very careful, and I reading a magazine about a bloated belly, and it started me on a long journey that they watched ovaries, they did testing. But I have a point that I feel near and dear about, that I skipped a whole year. I had great pap smears, I had great mammographies, and I miss a year, I go back and I had an endometrial stage 1 cancer. So women have to go, and no matter how silly the symptom or what the feeling or what they read, they need to follow through and see their doctor.
That's the message you want to share today. That's why you came on this program.
It is, because I feel that women should, I have a feeling about a transvaginal sonogram. I think women should have them. I think it detects many of the cancers. It might be debated with the doctor, but I just feel women have to be diligent and pay attention and find a doctor that will listen to anything that they say that is a problem.
And by the way, a sonogram, it's an internal sonogram.
Yes.
Is that required? Is it preferred? What? Look, more debate, more looking at each other.
I just feel that started me on the road to...
In your experience?
In my experience, in watching and being very diligent.
Reaction?
I think that Susan has excellent points. I think that she is 100% correct in trying to get the message out there for women to be diligent about their health care, because women are the ones who are going to be the best advocates for their health care and to discuss whatever they're feeling or they're going through with their doctors. That being said, once the issue is presented to the doctor, there should be a thorough investigation performed by the physician and the appropriate tests ordered.
Everyone is different.
Everyone is different.
But you must have your physician totally engaged and involved in your case. And if you do not have that situation and you're deciding for yourself what you think and diagnosing yourself, that is not what we're advocating here. You're saying what you believe was the best course for you.
And I don't think women should think anything is too trite or small to tell their doctor. I think you should, anything that's out of the ordinary, that you should tell your doctor and find a good doctor that's going to listen to you.
Let me pull you in here, and I promise we're going to talk about the other piece of this, which is the emotional, psychological, and the potential sexual issues associated with after the fact. When someone has one of these 5 gynecological cancers, there are real issues associated with that. Gilda's Club.
Well, to get to this conversation, I actually just wrote an op-ed, and I'm really upset with all of the mixed signals that women are getting about screening, whether it's their breasts, whether it's a physical exam, and now they've just come out and said, well, you know, we don't think that absolutely is appropriate, but yet something like that, you would have felt a bloating, may have felt an abnormality in the vagina. The Mayo Clinic tells you that those are good things to do, and now we have people saying, well, maybe not. And I really feel that a lot of these recommendations give cover to insurance companies to then perhaps not cover these exams and leave women in peril, because all of these years we've been saying screen, 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 and now we're saying, well, sometimes screen, sometimes don't screen. I don't think.
What should the average woman do right now watching on public broadcasting?
I think she should be diligent. She should screen. She should have her mammographies at an earlier age than they're recommending, because at Gilda's Club, 11% of the population is under 50 with breast cancer.
Say that again.
11% of the population that comes to Gilda's Club is under 50, and they have breast cancer.
And by the way, explain for those who do not know what Gilda's Club and why it is so special, named after the late, great Gilda Radner.
It's named after Gilda Radner. She, of course, passed away from ovarian cancer, but prior to passing away, she realized how affected her friends and relatives were by her illness. And she said there needs to be some place where everybody can go that is in a non-clinical setting where we can deal with these, whether it's member-to-member support group, whether it's just a diversion, writing down memories, yoga, whether it's wellness, and then, of course, bereavement. Is all part of it.
Quality of life. Melissa, let me bring you in. By the way, again, several websites you're seeing throughout this program listed by our terrific producers behind the scenes, because we know at public television our job is to give you information. Your job is to take it and go to the next step. That's why those websites are so valuable. Let me ask you. We can have an ongoing discussion about early detection, being your own best advocate, finding the right physician, all those things, and they're all important. But a woman does have one of these gynecological cancers. She is being treated. There's a real impact on her physiologically, emotionally, and psychologically. That has implications for her quality of life, which is in part her sexual life, no?
Yes.
Talk about it.
Well, aside from the body image issues, whatever type of treatment that she undergoes, a lot of the treatments that are involved with gynecological cancers do leave a woman in a situation where they could be put into menopause if they were not already there. And there are side effects related to that by going into it in such a drastic measure rather than a gradual measure, where they're feeling vaginal dryness, there could be pain during intercourse, there could be lack of desire, there could be tearing of the outside by the vulva and the vaginal opening. And a lot of these reasons make people not want to engage in vaginal sex and can also affect intimacy in any relationship.
So here's my question, doctor. To what degree, with all of the clinical challenges, with all the fear and anxiety associated with the initial diagnosis that a woman faces when you or one of your colleagues has to give the news that a woman faces, is dealing with cancer, and again, all different stages, all different circumstances, every case is different. Do you feel most of your colleagues are prepared for and in fact have such a discussion about the social, emotional, psychological, and sexual implications, A, and B, when?
So I agree that this is a major, major factor in what women go through. I mean, there are so many emotional things that women go through when they have a diagnosis of cancer, let alone hearing the word cancer. That's in and of itself.
What kind of things go on?
Very traumatizing. A lot of women hear just the word cancer and they automatically shut down and they don't hear anything else beyond that.
Do they hear death sentence?
Some women, and it depends what their personal experiences have been,
Okay.
whether they know people who have gone through cancer treatments, what sort of cancer treatments, something they've read, something they've seen. A lot of people, almost everybody has a certain association with cancer on
P.S.
some
Yours
level.
was not great for other people in your family, correct?
No. And
Okay?
It
You
made
had
me,
people pass away from cancer.
correct.
Even though that's not your attitude,
No.
you had that experience.
And it's a delicate balance between living your life and paying attention and being
But
diligent.
you did not have a great experience with other people,
No.
in spite of
and
your positive
I
attitude.
could have used a Gilda's.
Okay, well, go ahead. Pick it up, doctor.
And you know, this goes something to, I believe that you wrote actually in your op-ed when you were talking about, because I happened to see that.
Can we tell people
about,
so people can find it on the internet? What was the op-ed?
It was, I actually talked about the necessity
what-
for support.
what-
It was
what
in the
it
Bergen
published?
Record.
It was in the record, okay. Under your name?
Yes.
Good. When people see your name up again, look in northjersey.com, look under your name. That is the website for the record. Go ahead, doctor, I'm sorry.
So, you know, there's an array of emotional experiences that people go through. Some of them automatically shut down. Some people jump to the worst conclusion. And, you know, oftentimes that's why when we see people, people are encouraged to bring family members with them, bring other people with them, so everybody hears a little piece of something that hopefully can be put all together. Now, in terms of the sexual dysfunction that is associated with gynecologic malignancies, I mean, that is a tremendous burden on a lot of patients who go through cancer treatments. And on cancer treatments, I mean,
How do
people
most physicians deal with it?
It's a very challenging to
How do
deal
most
with.
physicians deal with it?
I think it's individual. It depends on the physician. It is certainly something that most diligent physicians try to address in terms of detecting it. Treatment is extremely difficult because, as you know, it is multifactorial. Many issues play into it, and it is something that requires a lot of attention, both from a psychological standpoint, from a medical standpoint, from an emotional standpoint, that really you need an integrated system to address.
I understand, it's complex and difficult. I just wonder if most physicians are actually trained. I mean, should a patient be expecting the physician, the gynecological expert, the clinician, to be doing that, or should it be coming from somewhere else? What did you? Go
I
ahead.
have a wonderful physician who pushed me in that direction and did it in a more lighthearted way, but
Go ahead.
really brought it to the surface because I was terrified, and you really, in my position, I don't want to think about anything like that because you're just worried about that whole system.
I was just saying that to our producers. I was saying, come on, worried about sex? And they're like, no, I bet a lot of women at some point would. And you were
It's hard
thinking,
to think of that. You're thinking of it totally different, your organs there, that it's,
well, once you knew you were going to be okay to some extent, were you sitting there saying, hey, wait a minute?
Well, I
got the
had a
rest-
wonderful physician who prodded me in that direction and said, don't worry about it, and come on, jump back on the wagon and live a
Is
normal
that what
life.
they call it, jump back on the wagon?
Well, that's how I took it, what you said.
I used. Oh, no.
She prodded
Did you say
gently.
is that
I
a
don't
clinical
know.
term,
Let
doctor,
me look
jump
back
back on
at
the
my-
wagon?
That's how I heard it.
But
As
you know,
long
as the patient understood it, that's all that counts.
You're a very good communicator, I can tell. The
is.
message
She
was
is
very clear.
wonderful.
So she understood, and then you did what you needed to do. Jump in and jump in. Go ahead.
Well, what I wanted to say is that, you know, when we talked about this prior as a group, that it's a brave new world. And it's
I
coming.
mean, before I came into the studio, I think is what you mean, but go ahead.
It's a brave new world in terms of in January, everybody's going to be required, all physicians are going to be required to indicate and to acknowledge the amount of distress that a cancer patient has
Wait, required by whom?
by the ACA, the Affordable Care Act.
Hold on. The new Federal Health Care Act,
Yeah,
otherwise known as Obamacare by some,
is going to
is going to
have,
require that physicians do what?
well, that they measure their distress and then help people deal with it. And that's why we, as an organization, are talking to all of these hospitals and attempting to provide them with it, because this is something we've been doing for 10 years. We have a proven method, but
It's a lot to expect of a
doctors,
physician.
and they can't do it. They have 15 minutes, 20 minutes with a patient. They can't possibly. And so what we're hoping to help is to help them meet that need.
But let's talk about patients here. What should patients, Melissa, what should patients be bringing to the table to have a conversation with the woman's physician, with a man or a woman, be it, you know, the gynecological specialist? What should they be asking?
Well, I think there needs to be some honesty from both parts, from the patient and from the physician, where there needs to be a dialogue about sexual function. You know, what symptoms are you, instead of just saying, you know, how are you feeling today, is what a doctor would say to a patient. The doctor should be asking, you know, is there any pain during vaginal intercourse? You know,
Really?
of course.
That's the conversation starter? That's
Why
some
not?
icebreaker. Are you serious? Like that direct?
Well, sometimes doctors will ask patients, are you sexually active? And some people are shy and uncomfortable based on their religion, based on the culture, the family they grew up in. It's a private conversation.
Sure.
They won't say what they're doing because they're embarrassed, whether they're married or not married.
But what if, see, I'm switching it on you now.
Okay.
You're saying what you believe the physician could be saying. I'm asking a different question. Say the patient is not convinced that the physician is going to start that conversation. What could the patient do to facilitate and move the conversation forward if the patient is thinking about it and is feeling better about the health side and saying, listen, I think I've got a good shot here. I'd like to have this conversation. What could the patient do?
I think they need to be honest with their symptoms. I'm having pain during intercourse. I'm feeling very dry down there. What can we do about this? They need to talk about all of their symptoms, not just, you know, nausea or vomiting or fatigue or any other side effect that they may be feeling from chemotherapy or radiation. They need to be honest about all of their symptoms.
Is it harder for most women, and I don't know if there's a study that shows this, I don't know if you sense this anecdotally, is it harder, do you think, for most women dealing with one of the gynecological cancers we're talking about, to have this conversation with a male physician or a female physician? The silence is deafening.
I think it depends on the person.
You just think it's person to person?
I think it depends
I do
on the
too.
physician. I also think it depends on the patient. But I think what shuts people down is if they have someone that they bring these symptoms to, and they either give them bad advice, or they give them non-medical advice, or they don't know what to do, and then patients are left wondering, you know, is this supposed to be normal? Am I supposed to just live like this?
And if they appear uncomfortable, I mean, that's the first sign. You're just not going to continue this conversation.
If you see, I know it's case by case, and I'll bring you back in. Do you think most of your colleagues are prepared for, ready, and know how important this conversation is?
Absolutely.
You do.
Absolutely. We happen to be fortunate that where I work, women are given the opportunity, patients are given the opportunity to address this on multiple levels. I feel, and Susan, correct me if I'm wrong, but this is my impression, to address it both with our nursing staff.
When you
Who
say
speaks-
it, address it.
Address a issue that may arise be it sexual dysfunction, be it anything else, but it's specifically a comfortable environment that we have our nursing staff that is very approachable, we have the physicians who are very approachable, and I feel like there's several levels which allows the patient access.
Not just the physician.
Correct. So if someone may be feeling, they're talking about their chemotherapy, they're talking about the radiation therapy, all these big medical things, they're like, oh, my sex, whatever, my sex life is my sex life, I'll deal with it. They have someone in between on that level also who maybe they are a little bit more comfortable with, at least bringing up the topic, who will then address it forward with the doctor, say, you know what, this has been an issue, she didn't really want to bring it up with you. Can you take it further?
But as a physician, you did bring that into the conversation where, like,
She drove it.
She did, and in a whole health, in a whole life, not just
Part of a bigger picture?
Yes, the bigger picture that you have to go on with your life, and I want you to be well in all aspects.
What did that do for you?
Well, it put me on the right road and put me in the thinking that was the way that I was safe and okay, and I have to go back to my normal life, and I guess.
How are you feeling
Carry
today?
on.
Because you look fabulous.
Wonderful, thank you, thank you, thank you.
You know, maybe because I'm a guy and guys are so incredibly self-centered, or maybe it's just me.
I mean, how would you feel if your sexual function was impacted?
Well, you're about to. Yeah, we had this conversation with our producers, all of whom are talented women. We have great crew guys who are mostly men. But I had this conversation with our producers before we got in here, and I said, if I were, I believe, I don't know, but if I were diagnosed with prostate cancer, first question would be largely about prognosis, odds, what do I have to do, life and death. I want to believe that soon thereafter, I'm asking the other questions about, I would just call it, because it's PBS, performance-related issues. The ability to, Terry, our floor manager, is giving smirking, performance-related issues. I would want to talk about that. Now, I don't know if that's more of a guy's, I don't know. But I'm surprised that women don't bring it up more. And what does a guy do in a situation, his partner is facing this and he wants to bring it up, but he's not the one going through it. He doesn't want to be self-centered, but he's with her. He wants to be with her. He doesn't know what to do. He wants to support her, but he's thinking, hey, what about us?
Well,
she's like, well, that's not your problem. I'm the one. No, you're looking at me. Why?
Yeah, no, because the operative word is partner. I mean, if they're truly partners, they will bring it up. And for a guy, you know, guys measure themselves by physical performance much more so, and it's obvious, you know, if you're not performing. And for women, that's not necessarily the case. And so another doctor, male physician, would say, don't worry, you know, or he would give you the odds on and you would discuss it. But the performance level is so totally different, I think, and the experience is so different.
Women aren't feeling like they're failures if they're not able to have sexual intercourse because
Right.
they've had gynecological cancers. You know, it's more of an intimacy issue where it's not necessarily the physical hands-on penis and vagina. It's more of the emotional relation, it's the touching, the cuddling.
P.S. there's a whole childbearing issue here for women of a certain age and situation, which makes it even more complicated.
Yes, but I feel that's a whole
That's a different
separate,
subject. I'm sorry. I shouldn't have brought that up. Sorry, I shouldn't have brought that up.
No, I'm not saying, I think that this is such a huge factor, and going to what you were saying, I agree with you. I think males have a completely different view on it than females. As, you know, as everybody knows, that women have the emotional aspect to it, the intimacy aspect to it, how it affects their relationship. I mean, so multifactorial.
Are we simpler?
No,
Men?
just different.
Okay.
So,
Could you equate that with breast
Thanks
cancer?
for saying yes. I appreciate that.
Breast
Georgette.
cancer in women, it's more overtly sexual. That might cause a dysfunction.
Okay, in the time we have left, let's bring it back to that. I'm sorry. What advice do we have for women right now in the couple of minutes we have left? The websites will continue to be up. Women, gynecological cancers, 5 again. Could we do it again? Because you might have just tuned in at any point. Cervical, ovarian, uterine, vaginal, vulva, right? There are obviously clinical, physical issues. There are emotional, psychological, sexual issues. There are support in organizations like Gilda's Club, right? There are professionals in your field as well. Yeah. Finally, doctor, advice for women right now. We're saying, listen, I don't need that test. I think I'm good. You say?
the best advice I can give to women in support of what Susan said as well, is you are the best advocate for yourself. You need to find a physician who you can relate to and who you can talk to, and you need to be aware of everything that's available to you. Going back to a major topic that we've been discussing for the past however long, in terms of sexual dysfunction, overall well-being, it is really, really important that a woman finds a doctor that she feels comfortable with, a doctor who has access to state-of-the-art technology and the latest developing treatments that are available out there, such as minimally invasive surgeries, things that will not interfere with a woman's self-image as much as a major incision would, and things like that, to be able to get herself the best care that's out there.
You've all done a tremendous public service for women all across the region. I want to thank you so much. Thank you.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by TD Bank, the New Jersey Education Association, Berkeley College, New Jersey Natural Gas, Qualcare Inc., Johnson & Johnson, and by NJM. Promotional support provided by New Jersey Monthly, the magazine of the Garden State, available at newsstands, and by The Record, North Jersey's trusted source, and northjersey.com. Caucus New Jersey has been produced in partnership with TriStar Studios.
New Jersey Manufacturers Insurance Company offers policies that can protect against auto accidents, fires, windstorms, floods, and many other serious and urgent situations. Tips on what to do before, during, and after you're confronted with the unexpected are on the emergency preparedness section of njm.com. New Jersey Manufacturers, helping the Garden State prepare for the unexpected for nearly a century.